Well, some are calling it the virus of fear. Emergency room visits all across the country and here in Western Mass are down significantly. Many people are afraid to go into the ER for fear of catching the coronavirus. Tonight, we talked to a top doctor at Mercy Medical Center who says his ED is safe, and in some cases, waiting to get treatment could mean the difference between life and death. At Mercy Medical Center, emergency department visits are down dramatically since the COVID-19 pandemic began.
Typically around this time of year in our emergency department, we would treat about 250 to 275 patients a day. And since this pandemic started, that number has been cut in half, and perhaps even more so.
Dr. Robert Roos, Mercy's chief medical officer.
We've seen a dramatic decrease, over 75% decrease in patients coming to the emergency department with abdominal pain, a 50% decrease in those coming with chest pain.
National numbers show people are hesitant to come to any hospital right now. Dr. Roos tells Western Mass News he understands that, but says in some cases, for example, if you have chest pains or other critical care issues, waiting could be deadly.
Absolutely. There are emergent conditions that could happen at any moment for people, and delaying care certainly could be a cause of a worse outcome. It could certainly be a matter of life and death.
Concerns, for example, that patients may come in asymptomatic, he says, are valid everywhere. However, at Mercy, he says they are taking every precaution. Every staff member wears appropriate protective gear, and even entering the ED is different.
So we have a process at the front of our emergency department where people are screened before they even enter the emergency department. So in a vestibule early screening area that then can direct people to the appropriate pod or area of the emergency department that would be separate, or for whether you have a condition that could be COVID or not.
He says there are entire COVID-free floors, separate elevators, and separate staff.
For those patients and families who may be concerned about coming to the hospital, we want you to know that we've taken all the proper precautions to ensure that we would mitigate any potential exposure so that the care can be as safe as possible.
Well, in the case of life-threatening medical emergencies such as heart attack or stroke, the American Heart Association and the American College of Emergency Physicians are also urging people to still call 911 and go to the hospital.